Hi, everybody. My name is Matt Webster. I'm the founder, CEO, and CISO of Cyvergence. Today, we're going to be talking about a very important topic because it does affect all of us. We're going to talk about the healthcare cybersecurity practices within the United States and what the impact is on healthcare. So this is extraordinarily important. This is going to be part of a larger healthcare series. Today, we're covering the US healthcare cybersecurity, but we are going to cover things like international healthcare and so on as part of larger discussions as we go on. So what are you going to learn today? Today, we're going to cover the status of healthcare cybersecurity. We're going to look at United States healthcare definition. We'll look at real-world cybersecurity impacts to healthcare organizations. We'll look at some of the differences of healthcare cybersecurity and how it affects the cybersecurity landscape. And we'll look at some of the regulations and their impact on healthcare. So the agenda today, the sections are defining healthcare, the healthcare threat landscape, healthcare cybersecurity status, healthcare technology, the impact on healthcare, healthcare regulations, and of course, Cyvergence services. So a bit of housekeeping here. I do work with very reputable sources, but please keep in mind because the way that they collect the information in these sources, some of the information may be contradictory, and that's okay. This is going to be moderately technical with high-level explanations, and I'll try to make it as easy and accessible for everybody to understand. So let's get into defining healthcare. There are a lot of different types of healthcare providers, and I've broken them down into direct and indirect. From a healthcare perspective, you've got the actual provider themselves, these are the doctors and the hospitals and things like that. But there's integrated delivery networks, ambulatory surgical centers, and so on that are part of the direct healthcare spectrum. On the back end, you've got a lot of supporting organizations. These are things like health plans, insurance, regional health information organizations, and various business centers that go on. So there's a large list of those. This is not intended to be a complete list. But what is healthcare information? It's basically, it boils down to protected health information, or PHI is defined by HIPAA. It's information that can be used to identify individuals while providing a healthcare service. And so it originates from healthcare organizations. It can be a doctor's office, hospital, and so on, and that's perfectly fine. It doesn't matter how many times that information goes out, it is still PHI, even if it goes through 10 different companies. All of that information is PHI. Now, over on the right-hand side, there are 18 identifiers when it comes to PHI. I truncated them here for simplicity's sake, but it does include things like name, address, phone number, social security numbers, and so on. What may not be immediately apparent to some of you is that this is also personally identifiable information for some of this, not for all of it. Now, if that personally identifiable information is collected by a healthcare organization, it is protected health information. So just keep that in the back of your mind when you're thinking about that healthcare information. It's always going to be. Let's take a look at the healthcare threat landscape. It's going to give you a clear idea what's going on. Now, for those of you who have seen my threat landscape report, what you're seeing here is the same thing. It's got a little bit of a twist, but in 2023, we hit 11.5 trillion in terms of the amount of cybercrime that's going on. It's continuing to expand. This year in 2024, we're going to hit, 14.5 million. So this is getting more and more serious when you look at the threat landscape. Presently, if cybercrime were a country, it'd have the third largest GDP behind the US and China. And the reality is that healthcare data is worth more on the black market than many other types of data. So it's very important. Healthcare is not the most targeted sector, but it's the third most targeted sector in the United States. So this is definitely a concern for us. But let's take a look at the key threat actors. Generally speaking, we're looking at external. That's 81% of the time for when you're looking at breaches. 20% of the time for internal. Multiple, meaning multiple partners are involved in here. It's 2% and partner 1%. When you look at the motivation, financial is expected. You're looking at 92% of the time, so that's nothing unusual. But also we have here espionage. It's 8% of the time. This means that these are nation state actors that are doing what they can to hack organizations. They've got the resources to go after what they can. So this means roughly one out of 10 times, they're going to be able to penetrate a hospital or other large doctor facility because they don't have the right technology to help protect it. And there's a lot of other challenges that we're going to talk about. But this is going to, but keep this in the back of your mind as I go ahead and talk a little bit further. When you're looking at the data, I find this really interesting. There's personal information, which is PHI in this particular case, but credentials, and I've talked about this before in the threat landscape, 37% of the data compromised tend to be credential data. 35% are other, but internal information is 19%. So there's a lot of data that's being collected today. And I think this is very interesting and telling for organizations today. And sometimes you're going to find it overlapping because organizations will try to hack more than one type of data out of an organization, something called data exfiltration. But you're looking at the breach patterns. Typically, what you're seeing over here is there's a system intrusion that's a little under 40%. Let's call it 35%. Basic web application attacks are fairly common as well. They're above 20% for sure. Social engineering is hovering around 20%, maybe slightly less. And then, of course, miscellaneous errors. These are people making mistakes. Maybe they didn't secure something properly from an IT standpoint, or maybe somebody sent out some information that wasn't supposed to be sent out. Those are very common types of problems within healthcare organizations. So there's something called a HIPAA wall of shame. This is a list of companies that have had HIPAA incidents or breaches, and it can be direct or indirect. Before I talked about business associates are affected by these types of breaches as well. So those business associates, if they get a breach, it's considered that the organization who got the information also had the breach. So there's a reason for something called a business associates agreement that you put in place. It's to make sure that they have the appropriate level of security to help protect their organization. So this is called the wall of shame because anybody can go up there and take a look to see who is affected by an organization over a period of time. So we're seeing 500 or more affected individuals, and it's roaming over 24 months. So this is not a perfect amount of information, but overall, it gives you a general idea for what's happening. When we look at the incident types, if we go on the right-hand side, you can see here, and this is just information that I happen to pull out from one segment of information off of the HIPAA wall of shame, covering a 24-month period of time. We saw that there were 727 hacking or IT incidents. 119 unauthorized access and disclosure, meaning they sent the information out, or there is a disclosure they shouldn't have, or there's unauthorized access to some of the information. The improper disposal is 4, loss is 5, theft is 15. But what you're seeing here is there is a tremendous number of people that are affected by this. We're talking about millions and millions of people that are affected by these types of breaches over a period of time. 727 organizations over a course of 2 years had a hacking or IT incident, would have affected over 135 million people. So just kind of let that soak in and think about, why is our information out there? Here's one of the reasons for that. When you're looking at the hacking and incident details, I picked out a few kind of interesting details that I thought were important. Typically, it's network servers. You can see that over 118 million people were affected by information sitting on a network server, but there are over 4 million people who are affected by these emails, these accidents that go out. Sometimes there are other forms of attacks that can take place related to email, but generally speaking, more often than not, it's typically an accident happens to go out. So being very precise and very careful and very deliberate is extraordinarily important for organizations today. There's EMR, electronic medical record systems. That was only affected by 13 organizations, but it is something that's important. So roughly 7 organizations are affected by that. And then desktops or laptops, sometimes the information is there on those types of systems. Luckily, it's only affected 10 organizations, but it's still affected more than 100,000 people. So this is just to give you a little bit of a background of what's going on from that perspective. But let's take a look at the healthcare cybersecurity status. This is where are healthcare organizations at today? And typically, This is coming from the Hospital Cyber Resiliency Initiative Landscape Analysis. So this is pretty solid information. It's coming in for Health and Human Services, but it does kind of show you where things are at. So if we're looking at threat and vulnerability information, for those of you who saw the previous one, these are things like vulnerability assessments and pen tests and some other things to detect problems. It's a way of detecting it. So 89% of hospitals are doing at least a quarterly vulnerability assessment, but that still leaves 11% of hospitals that are not even doing something quarterly. Also, quarterly probably is not enough if all they're doing is that, but I don't have, the report did not include information on how many organizations are doing this weekly versus monthly versus quarterly. We just know that 89% of hospitals are doing at least quarterly vulnerability assessments. What's more concerning, though, is only 20% of organizations were doing penetration testing, or some of the more advanced stuff like red teaming and purple teaming. And I haven't talked about those in the past, but the red teaming is creating a scenario to determine how can they get past certain defenses. Purple teaming is working with the detection teams to see if they're able to see what's going on within an organization. But the point here is that penetration testing is one of those foundational activities that organizations need to do to protect themselves. If only 20% of organizations are doing pen test, that's a big concern. And it starts to explain why we have so many breaches and so many problems from a healthcare organization. But the other side of the house, remember how I said that there were a good percentage of people that or organizations that were affected from the websites? Well, only 70% of organizations did vulnerability assessments against their websites. That's a big concern because they don't know what the vulnerabilities are. Maybe somebody introduced something on accident. There was an unintended consequence that made their system more vulnerable. So being able to do, and there's something called like DAST, dynamic application security testing, where you do this type of vulnerability assessment. But this is definitely very concerning that only 70% of organizations are doing that, and that's where a lot of information is kept on the website. So you need to be a little bit more mature about your processes. Now, we don't know what other compensating controls they had in place and if they have other things that might protect it, like a web application firewall. So this is not an indicator of risk. This is just a general idea that vulnerability assessments are not done. Typically, like a penetration testing, you want to do that against a website as well. But penetration testing typically involves some sort of vulnerability assessment. Now, what's more concerning, though, we've got these vulnerabilities that are identified. Only 53% had a documented plan to deal with the vulnerabilities. So they detected the vulnerabilities, but they may be dealing with it in a haphazard way or not really paying attention to all the details. Or perhaps some organizations interpret this a little bit different and said, well, we need a formalized plan, which is not always what you necessarily need to do. It definitely helps within organizations. But if you've got an overall process that's taking place where these are being handled by an internal ticketing system, that should be sufficient. But this is definitely concerning to look at this and go, this looks like it's a problem. Now, security awareness training is one of those things that I haven't talked about yet as part of the Cyvergence, but it is an important part of protecting organizations. You need to train staff on the responsibilities related to security. You have to take time out to explain to them, because if they make a mistake or not doing something right, and you don't train them, then that's on the whatever operations team or security team's responsibility to, rather than on the people who made the mistake. They need to understand what their responsibilities are related to security in an organization. 86% is concerning. It's not entirely surprising, and we don't know the content for what's going on. But if your doctors don't know their responsibilities, that could be a big problem. But it could be other people as well, not just doctors. Now, multi-factor authentication, I thought this was pretty good. It's still a little bit problematic. 90% of hospitals had some form of multi-factor authentication. That's what MFA stands for, multi-factor authentication. But 85% of them had it on a VPN. So if you're not familiar with a VPN, if you're logging in with some of your systems from home, and then you make a connection back to the hospital from whatever system you're working on, that's usually over something called a VPN, and it's exposed to the open internet. So if you get like the username and password, and there's some exceptions to this, but if you get that username and password, they can probably gain access to the environment if you don't have multi-factor authentication. It's one of those, again, it's one of those foundational items that you should have in place to protect organizations. 88% of email systems also had MFA. I thought that was fantastic. A lot of organizations don't have that. So to see that they had MFA on an email system is fantastic. But email security also covers a lot of other things than just MFA. If we go over to the right-hand side, we can see that 99% of organizations had some sort of spam protection. And given that a lot of attacks come in through spam, this is very heartening to see. 92% had URL detection. So URL detection is very interesting. Some of them would have response, some didn't. It was a little open in terms of interpretation from looking at the report, but it would be if an email is coming in and it's got a URL that's embedded within it, it's going to be detecting it, and sometimes it'll replace it, sometimes not, or it's going to put in a different URL or block the URL from having that information get through that could be harmful to the organization. So 92% is pretty good. I mean, it's not perfect, but it's a good start. 86% had automated responses for removing a malicious email. So if one gets detected that's bad, it automatically goes in and pull those emails out so people don't click on malicious links or get fooled by various forms of attacks like phishing or spear phishing, etc. What's a little bit more concerning, though, is that 49% of organizations had adequate supply chain risk oversight. Only 50% of the organizations actually considered the risk to the patient when taking a look at the supply chain risk. So supply chain is something that's, for those who are not familiar with it, it's very broad. It covers a lot of different things. So you can look at things like, what kind of devices are you bringing into your organization? We're going to talk about Internet of Medical Things, IoMT, fairly soon. But if you're not considering that as part of it, well, the risks are important. A lot of times they're looking at how can the doctors operate more efficiently when they're considering the products that are being brought in. But also you have to look at third-party risk, which is a small part of supply chain risk, but you have to look at this whole ecosystem of interconnections. Now, one of the concerns about this report, it also had said that 46% of ransomware was caused by a third party. So this is, again, very concerning because you're looking at poor supply chain risk management oversight. And then you're looking at ransomware being caused by a third party in roughly 50% of the cases. It starts to show you what the problems are within organizations. Now, legacy systems, I actually was kind of scratching my head on this one because I think that all hospitals, unless they're brand new, and I don't know the percentages here, this is just my perception, but said that only 96% of hospitals report of end-of-life systems. I would assume that all hospitals have some sort of legacy system sitting out there as part of their organization. I don't know how they worded the question, but it is extremely normal to have legacy systems within an organization. If you're buying an IoT system and it's going to cost you several million dollars to have it in your organization, you're going to keep that thing around for years. It is really normal. Or sometimes the system is going to be put in place, but the operating systems underneath that are not secure. We're going to talk about that more in a bit, but I definitely think this number is a little bit low for legacy system because it is so ordinary to have a legacy system within an organization. So let's take a look at the technology for healthcare. There's traditional systems, often we're used to it. Many of you are familiar with it. There's some physical systems, there's networking systems, cloud systems, there's centralized management, a lot of the standard stuff that you would expect to find in a traditional organization. Everybody's got a server and a workstation and email and some stuff like that. These are pretty traditional across the board. Healthcare specific is a little bit different because a lot of times when you're talking about IOMT and some of these others, they're going to go through continual evaluation processes, working with doctors and things like that to see that the products are working appropriately. And it's that continual improvement model that's part of healthcare organizations today. Also, the deprecated initial systems, like I said, 96% seem low to me, but you're going to find that in many organizations. Also, IOMT is a big challenge. They've got different types of physical connections and weaknesses and network and cloud connections, but we're going to talk about more of the details soon. But let's talk about the basic IOMT technology first. There are basic connections that are going into it. It's going to be like traditional IoT systems that are going in. And a lot of times the IoT systems are very weak. They're very simplistic. There's a lot of easy ways of hacking those systems. And that's just part of basic IoT. But a lot of times there's much more advanced technology. They're going to have a full operating system behind that. And sometimes you're going to find a lean operating system and they've truncated down to the simplest possible operating system they can get. And those tend to be a little bit better than some of these others. But some of them are like a full Windows system in the background, and they're really common in organizations today. And that full operating system is going to have some other challenges, but this is going to give you an idea. When we're talking about IOMT, it's a broad spectrum of different type of IoT technologies. So when you get into those medical devices, obviously from a telemedicine perspective, they're going to be things like wearable devices. These are usually like for more monitoring and checking things. There's implanted devices that can go in that can help provide medicines and things like that, or sometimes it's a pacemaker. There are a lot of things that are going on from that perspective. What is less of a consideration, but still considered part of telemedicine and still an IOMT, is ingestible devices. So these are things that are used to scan certain things in your body. You swallow it, and they do scans while it's going through your body to see how quickly things are moving through. And that's a big part of what we're dealing with. But then you've got communication systems as well. These are just standard stuff, but that's all part of telemedicine, but it isn't necessarily an IOMT. But thought I would mention it here just for additional context. But of course, you've got stationary medical devices. This in no way is intended to be a complete list on everything, like the magnetic resonance imaging or X-ray machines, or there's a lot of different types of patient systems that are going around beds and things like that. So there is a lot going on from a medical device perspective. So there was something called OWASP, the Open Source Web Application Security Project. And what they did is they started to move into the OWASP IoT Top 10. And now this is circa 2018. There isn't a 2023, 2024 earlier version. The one before that was from 2014. But basically, all of these IoT top concerns are also applicable to IOMT, the Internet of Medical Things technology. So we're going to go through this in depth because I think that this is important enough so people can understand what the problems are that hospitals are facing. You know, many times they have weak or guessable or hard-coded passwords. So a hard-coded password is something where the password cannot change. The password is in there. Somebody can Google it and try to get that password. It gets in so they can start to do things. Sometimes that's guessable information. So that means it's something easy like 1, 2, 3, 4 or password or some other type of simplistic things. So this is a big concern because that means that the IoT devices can be hacked fairly easily for the ones that have this vulnerability. A lot of times the network services are insecure. This means from a hacking perspective, there isn't much hacking to do because they can get past a lot of those devices. They get something called a man-in-the-middle attack. They can observe what's going on because there's no encryption in many cases. Again, it depends on the device and depends on the company, but it's a big concern today. There are insecure ecosystem interfaces. So how they interface with one device and another device, it's going to be completely insecure. So when you've got a whole bunch of different types of technologies that are going on here, it again is a very big problem. The lack of secure update mechanism. So sometimes you have a system and you cannot update it, you cannot patch it, and you cannot do anything with it. So if you have a vulnerability on there and you're going to keep that device for a long period of time, that vulnerability may just sit there, and this is, again, unfortunately, very, very common for organizations. So this is big, and some of this is by design. Sometimes you'll get it's like a full Windows operating system, and they say, sorry, we don't allow you to update the system, because if you do, you're going to invalidate the warranty. You're not allowed to install anything on it to protect it. So if you can't even protect the system and you can't update it, the system is basically a whole watering hole for a hacker to sit in the environment and go after. You don't have a way of monitoring things from an IOMT perspective. There's use of insecure and outdated components. That's kind of par for the course when it comes to IOMT. Some companies are striving to make some changes there. We definitely have a ways to go in order to try to do things. So insufficient privacy protection. Again, this is very problematic that you don't have some of the basics that are involved in there. Maybe they're not, don't have the data that's being collected. It's not being stored in a secure fashion. So when you're talking about privacy protection, this again is a big concern, There's insecure data transfer and storage. And this goes back, probably no encryption on the storage. They're transferring the system off the IOMT system to another location and it's insecure. That's problem too, because that means anybody in the middle can go grab that information. And if it's not being stored properly, once a hacker gets in, they can go in and hack that information and pull it out. Again, very concerning from an IOMT perspective. Lack of device management. Now, let me kind of have this make a little bit more sense to you. When you're talking about like a Windows system or many Linux systems, you can centralize the management of the console or the system that you're working with and perform these updates and patches and manage the systems all from a remote local area. If you've got 200 beds in a hospital, which is not terribly uncommon, you would have to pay a human being to walk around and change the configurations manually on each device for each of those. So if you've got, 20 devices around each bed, and then you've got, 20 different devices, 200 different beds, you've got a lot of systems that you're paying somebody to walk around. And when you're doing things manually, people make mistakes. I would make mistakes if I were doing it. This is just a normal part of the process. So the lack of device management is definitely a big concern here. And it just takes a lot of overhead in order to manage the systems properly. Another concern is insecure default settings. So not only can you not manage it, you can't detect what's going on, and they're insecure by default. So you need to make changes. The other thing that's a big concern is lack of physical hardening. So there's an age-old expression in security. If you have physical access to a box, you own it. That means that you can do whatever you want to. So you can gain access to it. They don't lock it down. So anybody can go in there, make modifications and do some things. It's simply not secure for doing that. And you've got these devices that are sitting around the bed. Sometimes you've got, 15 to 20 devices per bed, and they're not hardened properly. Somebody who's kind of curious might go poking around at some of the stuff. They're not supposed to. And hopefully, but they could get bored and start to do things. Now, most people are going to be good people in doing that, but all it takes is one or two people to cause a problem is by going around and toying with the different things. And then you've got to spend the time to go check on what's going on. The lack of physical hardening and putting all this stuff together, you start to see why there's so many problems with IOMT. So there's a lot of challenges. I've already mentioned, typically there's 15 to 20 devices per bed. A lot of times these devices are kept for 15 years. So when you've got old devices with old vulnerabilities that are sitting there for 15 years, a hacker can get in there and do whatever they want and sit there, especially if you're talking about a Windows system. You can't monitor it. You don't know if there's any problems with it. It's a huge challenge. How do you protect an organization when you're dealing with these types of challenges? There are alternate controls for protecting a lot of these things, but a lot of them are time sensitive and challenging in terms of trying to get the work done here. So just keep that in the back of your mind. When you're talking about external challenges, there are a few options for secure systems, but that means that they don't have options for trying to pick something. Now, the FDA, and I'm going to talk about that a little bit later, does take a long time to approve devices. A lot of times this can be up to 5 to 6 years to get things done. So this means that the operating system they're working with, it may not get approved for 5 to 6 years when they've already done the development on one type of operating system. It may be deprecated, or it may not have the option of being patched or updated. So you start to understand why we have so many problems from a secure system, from an IOMT perspective. You oftentimes cannot install cybersecurity software on the devices. You can't monitor the devices. You can't patch them. You can't send the logs anywhere, depending on the device. And so you end up with a lot of challenges here that IOMT typically faces. Let's take a look at some of the impact on healthcare. But before we do that, I want to take a look at the to understand why we have some of these issues. Like today, we're looking at an internet-connected ecosystem of technology and data and so on. We are constantly evolving. We've got cloud devices and IOMT connects into it. There's a lot of other types of systems, like I already talked about EMR, the electronic medical record systems that are out there that information has to flow over to. There's operating systems. So sometimes the information is going to go to an operating system. Sometimes it's on something called a server. Sometimes it's stuck on a workstation. It just depends on what type of device it is. There's a lot of software that's going on. If you looked at the threat landscape before, you can start to see that there's tons of problems. And when you're developing systems very quickly to try to make sure that it's going to be good, how do you actually know that the software is going to be protected properly? Of course, you've got the data, you've got a data that's being constantly collected and being sent over from one place to another. But then there's also open source software. For those who are not familiar with it, there are a lot of sites on the web, and those who didn't take a look at it, I'm going to be talking about that later, where the software is out there. So you don't have to redevelop the same software that's been developed 1,000 times over. You can just download it, install it as part of your application, and then it's built in, which is a good thing. It saves companies millions and millions of dollars in terms of development, and they're able to move much more quickly. There's a lot of positive with that. But it also means that you might have 10,000 people going in there and making adjustments and changes to the open source software. Now they've got their own system, and sometimes you have people that are authorizing and checking on things to make sure that this is done right. But there's still a lot of vulnerabilities that occur with that. And so that's yet another challenge when we're talking about that interconnected ecosystem. The reality is that for hospitals today, when we're talking about this whole ecosystem, it's a growing attack surface. There are so many different points today that you can connect into these devices to do what you need to do to create things that hackers can take advantage of. You go back 20 years ago, it wasn't the same landscape that we have today because everything has gotten so much more complicated, and IOMT has only added yet another aspect of that. The reality is, though, with all of this, when you have greater connectivity, you have greater risk. From an IOMT perspective, you have a vast proliferation. So it may not mean much. Oh, you got 20 devices per bed, but how many servers and how many workstations do you have? Probably far fewer. So the reality is you have more devices that you oftentimes can't protect than you can protect, depending on the organization. There's a lot of variables that can go into that, but this is definitely a concern that IOMT is a large percentage of an organization. A lot of vulnerabilities are very present in it. A lot of times old technology, you can't patch it, all the same stuff that we had talked about before. But from an open source standpoint, there's very little security oversight. There's a lot of times insufficient documentation. The packages are compromised or being created by threat actors. They're going in there and using that as a watering hole attack, where it's someplace where everybody wants to go to and use it. They create a poison in there, then it infects lots of different systems. Rampant vulnerabilities, intellectual property issues, and sometimes you can't tell what's going on from an open source standpoint because you get things like brand jacking and typo squatting. So you really don't know what's going on. It can be confusing. Now, for the most part, it's fairly good, but it's an insufficient, imperfect process when you're looking at open source technology. But you can start to see what a challenge it is to protect hospitals today. So there's a lot of real world impacts on that healthcare, though. So 88% of healthcare organizations had a cyber attack over the last 12 months. Not entirely surprising. 4.9 million is the average cost of a single most expensive attack per institution. 4.9 million. So this means on average, 88% of the healthcare organizations are experiencing a $4.9 million attack if you're looking at this. And if you consider that it's growing, how quickly the threat landscape is changing, it's something to consider. The average cost of a disruption, 1.3 million. That's definitely nothing to laugh at. 54% had an average of 4 ransomware attacks. And again, these are dealing with hospitals and things. And 68% of that group said that it negatively impacted patient safety and care. This means that people cannot get the care that they need because of the cybersecurity. What is concerning here, too, is in ransomware, if you're taking a look at it, it's kind of leveled out a little bit. It's roughly, depending on what source you go from, look at, it's between 20 to 25% of the attacks out there are ransomware oriented. There's a lot of other things going on other than ransomware. But when you're looking at ransomware in the healthcare space, there's a 278% increase on ransomware attacks over the last year. 278% increase. Again, very, very concerning. We had our first hospital in the United States that was shut down, St. Margaret's Health in Spring Valley, Illinois. and they couldn't afford to stay in business anymore and they closed. So this means that people who were relying on that hospital can no longer do so. So this is something that everybody should be aware of, but you start to understand, well, why protecting healthcare is so difficult. But let's go into some of the regulations. I think that these are interesting to take a look at. So a lot of people are familiar with HIPAA. I talked about the Health Insurance Portability and Accountability Act of 1996. Did you have the HITECH Act? The HITECH Act basically gave HIPAA teeth, is what they described it as. And this meant that the fines were going up as a result of HIPAA violations that were going on. Now, the CPRA is California Privacy Rights Act. It was a modification to the California Privacy Protection Act. Now, what's happening there is there's a lot of very interesting changes, and this only affects California residents. But if you anonymize data from a federal standpoint and you give that data to somebody else and they re-anonymize the data, it is not HIPAA data because you anonymized it. You follow the laws, you did what you were supposed to, but it is no longer HIPAA data because you're pulling in the data from another location. What CPRA does, it comes along and says, if you provide the data and you're able to identify who the person is, that data becomes healthcare data once again. So that is a huge change because now you've got to pay attention to where is your data going within an organization. But it is starting to have an effect. It's more affecting the California residents or for hospital systems that are in more than one state that happen to cover California as well, or if they need to transfer information from a California resident over into another hospital, this could start to affect them over time. So there's a lot more to it. It's considered a privacy regulation, but it gives you an idea about some of the challenges from a regulatory standpoint. Now, high trust is not a regulation. Now, I'll put some context in it. It is a compliance model that companies can follow. Generally speaking, though, what's interesting from a legal standpoint, there's no HIPAA certification. You can't get certified in HIPAA in terms of making sure that an organization is secure. You can have an assessment and you could say, yes, it looks like you're meeting all the HIPAA requirements, but high trust is an alternate methodology for looking at HIPAA. And if you are compliant with high trust, you're compliant with HIPAA. Now, there's a lot to it. I'm not going to go into all the details behind high trust, but it is an interesting mechanism that some organizations are choosing to follow. It's a very robust and tough model to follow, but it's something to be aware of. Now, UL 2900 is a very interesting standard. So this came in from the Veterans Administration. The Veterans Administration was trying to figure out how do we deal with all of these insecure IOMT devices because none of them were being built in a secure fashion. They're very insecure. So what do we do about that? How do we handle that? And so being a very large organization, they actually developed a public-private partnership and try to figure out, well, how do we create a standard to make sure that our devices are secure so they don't have the gaping problems that they do in most hospitals. So what they did is they worked with UL. UL came up with the 2900. And what that is, it's a series of tests to make sure that the systems are secured properly. So that is a huge win for organizations today. UL 2900 is a massive win. You know, there's some organizations are not a fan of it because it does stifle the innovation because it takes a little extra time to go through some things, but at least it's going to give you some sort of thing. Now, the Veterans Administration is large enough where they can change what the manufacturers are doing, and they could say, you know what, you better make those devices secure. We're not going to buy it. So a lot of the manufacturers got in line and they started to move towards UL 2900 to make the systems more secure so they could sell over to the Veterans Administration, one of the largest buyers within the United States when you're looking at healthcare technology. So it was a huge win because they have the wherewithal to push for that information. And just being the sheer size and volume, companies want to get in line. There's some other things that are out there. There's health information security practices. It's a guideline. It tells you a lot of the stuff that's in the security rule within HIPAA, but it does help organizations kind of not have to go through all the weeds to figure out what's going on and how do you make yourself more secure. And it talks about different sizes of organizations as well. So the FDA came up with something a little bit different. They came up with a cybersecurity bill of materials. So remember I talked about that open source software that's being added into bringing things. So anytime you start to develop something now and you use that open source software, you have to have a bill of materials. It's called SBOM in the rest of the world, but it's similar to the same thing. For any type of IOMT device, you need to have what they refer to as a CBOM that's part of it. So this way, if there's a vulnerability, you at least are aware of it. There are a lot of challenges. Like you can't just go ahead and scan a lot of the vulnerabilities on traditional healthcare software because it's going to create some additional challenges. So this is part of their mechanism for being able to work with things over a period of time. Some of the other changes as well, the Department of Justice and the FBI are treating attacks on healthcare as threat to life crimes. So that's going to affect things for people that are looking at things from a US perspective, but a little bit internationally because they're going to look at that as a threat to life and they're going to go after other organizations or even other countries that are doing the attacks against the United States healthcare systems as a threat to life. So they're going to be given a little extra priority to start doing the right things. Now, the Biden administration has done a couple of different things. They're working with the Health and Human Services to try to change things, to get some better regulation in place to help protect hospitals because they are under attack every day. There's also new IoT regulations that are coming out. So that's very interesting because now you have a letter grade on the security is what they're trying to do. And I'm being very generic with a lot of this stuff. So you might get a letter A for a grade. If you're able to patch it, you have updates, you can install the software on it, you can protect it and do all these other things. Well, it makes it a little bit easier. So you don't have to do this intense investigation behind the software, find out what the problems are after the fact, or do an in-house penetration test against a particular thing to find out what the problems are. It's got the letter grade on there. Is it going to be a perfect system? No, but you could say as an organization, we won't work with anything that's got a B or below, or you got a C or below for the level of security that they have. So I think this is a good step from an IoT perspective because the IoT is going to bleed into the IOMT security. Also, New York, Kathy Hochul is signing something into place to start creating more requirements for hospitals to be better protected, just because of all the problems that are going on here today. This is not just something that people are making up. It's being paid attention to, obviously, at the state level and the federal level, that these problems are happening today. All right, we've covered a lot. You can start to see where the problems are coming in, but there's a lot of things that Cyvergence can do to help out organizations today. We can do HIPAA compliant risk assessments. There's some specific requirements that go into that. There's risk registers. We can help out cyber risk quantification as part of the process that we work with. If you want to do gap assessments, we can choose HIPAA, the HIPAA security rule, for example, look at NIST CSF or scale things down for smaller organizations. We can help you out with the supply chain cybersecurity that the FDA requires and start to build that up to improve your organizations. If you need a virtual CISO, Chief Information Security Officer, happy to do that. We have managed services. Of course, we can resell cybersecurity products and services. We do not resell IOMT devices, so just keep that in the back of your mind. We are a cybersecurity company. We'll also help you with things like incident response planning and so on. There's a lot more that we can do, but at least this gives you a rough idea of some of the services and stuff that we can do. On that note, I know we covered a lot. It's a little bit of a heavy topic that we were getting into today. I think it's very serious and it's one that we have to consider. But I want to thank you for sticking with me through this. If you like the presentation, you want to see more things like this, definitely follow us on YouTube and LinkedIn and so on. But also follow us on LinkedIn, X, Instagram, and Facebook. I want to thank everybody for their time today. It's been very much appreciated, and I look forward to hearing from you soon. Thank you so much. Bye-bye.